Let's get some perspective on the COVID situation here.
Flatten the curve.
Flatten the curve.
Flattening the curve.
Remember that? That was the slogan run by governments and institutions around the world back in early 2020, when we finally realized COVID wasn't going to stay in China. It's now November and we're still in lockdowns of one form or another, but according to the evidence, we nailed it. The curve was and is flattened. There was and is no healthcare system disaster in Canada, but if we only listen to the mainstream media narrative and the daily government briefings, we'd quickly realize that the story being told on TV doesn't match what the numbers suggest. To sort out this discrepancy, let's go back in time to early March when this thing first hit Canada. We all did our part, stayed home, ordered food in, watched a lot of Netflix. There was no toilet paper in the stores, but we survived. 2 weeks to flatten the curve. And then they went by. Then a month, then half a year. Now we're preparing to enter 2021 and we still haven't returned to normal. What happened on the way to flattening the curve? When and where the media narrative changed is sort of muddled, but sometime during the summer, the media and many governments shifted from a focus on deaths and hospitalizations to cases. And only cases. And yes, if we did only focus on cases, it does seem scary. We're now at a way higher caseload than we were back in April and May. But when we compare cases against the resulting deaths and hospitalizations, we're doing very well. Our current hospital admission rate is well below half what it was back in April and May. And thankfully, we haven't gone over 100 daily deaths since June. Our death rate remains very low, with some days in October and November only experiencing single-digit mortality for the whole country. And if we're being honest, we can take these numbers with a grain of salt, because they are the total deaths with COVID, not necessarily deaths of COVID. Which is not to suggest that these losses of human life aren't tragic, and it is disingenuous to suggest that's what we mean. Those numbers on government websites aren't just tallies on a spreadsheet. They're someone's mother, father, son, daughter, or friend. It's a tragedy, and we have a right to be sad and upset when loved ones die, especially from a seemingly preventable disease. The numbers do tell us, however, that we don't need to panic, and that we should be encouraged by the lack of fatality in those younger populations, with near zero mortality for the 0 to 39 age group. Now, let's take a closer look at those scary high cases. An investigation by the New York Times discovered that up to 90% of our cases are false positives, due to the way the labs running the tests are performing what are called polymerase chain reactions to increase the number of viral particles so they can be detected. That means we have people walking around as positive cases on a tally sheet with no infection in them whatsoever. And that's not us saying that, that's the New York Times and Dr. Fauci.
You almost never can culture virus from a 37 threshold cycle, even 36. You got to say, it's just dead nucleotides, period.
On top of that, the World Health Organization told countries around the world back in early October to stop using lockdowns as a way to control the coronavirus, and instead reiterated that hand washing and the distancing are the best methods to control the virus. Then, health professionals worldwide started signing on to the Great Barrington Declaration, which urges governments to switch from general lockdowns to targeted protection for the vulnerable. We should be talking about getting our countries and our lives back to normal. We've had Easter, summer-long weekends, Thanksgiving, and Halloween taken away from us. How many people couldn't get married or couldn't hug their dying grandparents because of the lockdowns? And now the evidence is telling us that things such as suicides, opioid overdoses, anxiety, child abuse, alcohol abuse, marital strain, missed surgeries, and other ailments are being felt across the country because of the COVID lockdowns. Despite this evidence, we have politicians like our very own Prime Minister talking to the UN back in September, using COVID as a reason for resetting the economy, and using this time to focus on building back better. What exactly does he mean by that? Sounds to us like he and many left-wing governments are taking this time to focus on implementing their pet projects and ideologies instead of helping their citizens. The conversation should be about returning to normal, not the new normal of communist China-style all-pervasive government. And then, of course, we've heard countless stories about politicians ignoring their own directives and going and enjoying weddings, family gatherings, in the airport without a mask on, or going to large outdoor protests that by rights should be broken up according to their own rules. Living with COVID will be easier when we develop population immunity, and there is scientific evidence that we are already accomplishing this. Not to mention we have several highly effective vaccines on the way. We need to think about what unintended consequences we're going to face if we don't change things now. And letting ourselves be frightened by bad statistics and a loss of perspective into adopting failed ideologies is surely not what the doctor ordered.